Hello, my name is Soheila Rostami. I'm an oculofacial plastic surgeon. Today I want to talk to you about who is candidate for having minimally invasive procedures for face tightening and facelift, and who is a candidate for real facelift. So we have a machine, it's called FaceTite, BodyTite at Sanctuary. And a lot of patients come in to have minimally invasive procedures, and they ask specifically for not having surgical procedures. But you have to understand there are limitations to these machines. They can produce some results that are wonderful for patients that are good candidates for those procedures, but they do not replace the facelift procedures. So we usually recommend the FaceTite neck tight or minimally invasive non-surgical procedures for facelift results to patients that are around 40 to early 50, and they have very minimal laxity of their tissue. So it's not just the laxity of the skin, but the laxity of the tissue. And so when we touch the skin and the tissue under, we can see some improvement when we lift it, but it's not a lot of skin accumulated when we lift the tissue. And the patient is not showing me that they need the surgery results. So the older patients, like when you approach late 50s, early 60s, 70s, those patients, they really have a lot of laxity in their tissue. Yes, we can perform those minimally invasive non-surgical procedures, but the results will not be so obvious and the patient will not be very happy. Yes, they will get some improvement for sure, but because it's not what they're expected and their expectations are higher, they will not see the improvement they were looking for. So remember these advice that I'm giving you. We only offer those minimally invasive non-surgical procedures for lower and neck area to patients that are elderly, older than, I wouldn't call it elderly, but I would say patients that are older than late 50s. I would only recommend that for them if they're medically not approved for any surgical procedure, because really they will not see the improvement they're looking for. So the earlier you start with these procedures, the better results you're going to get, and they are really for those patients. Now, there are a lot of surgeons that they say don't do these procedures. I'm one of those surgeons that I say, yes, you can do them, but remember, you cannot do any kind of surgical procedures for 2-3 years, up to 5 years after these procedures. And the reason is the tissue will be very adherent to the skin would be very adherent to the tissue underneath, and so it would be surgically very challenging for the surgeon. But I've seen a lot of my patients after 4 or 5 years, when they're ready to have the surgery, actually the surgery is very similar to what I have done before without having any kind of surgical minimally invasive procedures. So in my hands, I really didn't have any issues performing the facelift, neck lift on those patients, as long as they waited 5 years after, or like 3-4 years after the procedure was done. So I hope this was helpful for deciding if these procedures are something that you would be interested in. Thank you.